healthcare costs are so extremely expensive. And we have a whole vulnerable population who can't afford healthcare, and they are literally making decisions between food, housing, and medication. That's really hard to deal with as a pharmacist. You know these patients need their medication, and you know they don't have the money to pay for them. All of us are heavily invested into our patients' lives. We spend a fair portion of our time trying to find resources for our patients who are under or uninsured. We can find the resources to get the patient the medications they at an affordable price, something that they really can budget into their monthly expenses. They get healthier, they get nicer, they get friendlier, they come in and thank you, they cry at your counter. And we have had people who have come in and told us that we have completely changed their health and well-being. We aren't a free clinic. We get a little bit of government funding to help subsidize those who are under and uninsured. But we also rely on Medicaid, Medicare, private insurance, being able to put those dollars back into what we do. All of the profit that we make at this company goes back into what we do. Mike Haffen and I have known each other for several years. We actually go to church together, and Mike and I were having a conversation, and he found himself in the position of being uninsured, and he had never been in that position before.
I was hurt on the job, and I lost my insurance, and I knew someone who worked here, and they turned me on to it, and been coming ever since.
I mentioned to Mike that he might want to come down to the health center and become a patient, because that is the way that you're able to take advantage of our pharmacy services. So you have to be a patient of our health center first and see our medical providers.
Well, I've got 3 grandkids, and I want to be around when they're very young, 7, 3, and 7 months. So I want to be around when they get married and graduate college and all that. And then the track I was on before I did all this, like I said, the A1C was 9.6, sugar was over 200.
We have a technician who works on patient assistance, helps fill out the drug manufacturer paperwork, obtains the supporting documentation, gets prescriptions, gets signatures from patients and from providers, and processes those prescriptions with each drug manufacturer. And Mike was able to get a 4-month supply of insulin for free. That's huge. That makes all the difference. And so if you're talking about going from a $300 or $400 expense in insulin to nothing, that's a lot of money. And you don't have to figure out how to survive and not take your insulin.
I think it's fantastic. Between the 2 doctors that I've had here, they've gotten my A1C down from 9.6 to 7.4. I've lost weight. I've talked, with the dietitians here. They're fantastic. Everybody's very helpful.
Looking objectively at what slows the pharmacy workflow process down, undeniably, it's the phone ringing. We were trying to figure out what's the best workflow, and what we did was to take the telephones out of where the pharmacists were working. So we have a call center that currently we have 3 workstations in the call center. We have a pharmacist and 2 technicians who sit back, and they're processing electronic prescriptions coming over into NRX. They're answering phone calls coming in directly. They are monitoring IVR. They're working through Pharmacy at a Glance.